Hi friends, I am Anida, one of the trainers at ACE Campus for English Language. This is a section on OET writing task. Most of our students come up with several specific doubts and questions regarding the OET writing task. So here I am to help you with some such doubts, and I will mention some of the most relevant things that you should keep in mind while doing the writing task in OET. One of the most important things that you need to keep in mind is that OET letter writing is based on the case notes or the patient information, and it usually is addressed to another healthcare professional, a social worker, or a dietitian. And it's crucial that you need to read and understand the case notes and the most relevant points. Additionally, time management is also very important. Usually, the OET letter begins with the date, and our students are confused of the date which they need to write in the letter. So, in this case, you can write the date which is given as the discharge date or today's date. And in those case notes where no other dates are given other than the admission date, you need to calculate the discharge date with the days hospitalized. Or if it is the home visit date given, you may write it down. And if no dates are mentioned, you can write today's date. I hope it's clear for you. And the next doubt that our students usually ask is regarding the to address and where to place the definite article the before the to address or the designation. So in this case, keep in mind that you can write the definite article the before the job role or the designations without name. And if the name of the person is already given in the address, there is no need of writing the definite article the. But if it is just given as if to write the letter to a physiotherapist or a head nurse of another hospital, in that case you need to write down it as the physiotherapist or the head nurse. Another doubt is regarding the reference, which title to write in the case of the female patients. So in the case of male patients, there are very less chances of getting doubts. But in the case of female patients, there are so many doubts, like which to write, the Miss or Mrs. Especially in the case of the divorced, divorcee, widow, or single patients. So in these cases, you can write Miss. If the age of the patient is below 18, also you can write it as Miss. So another doubt is regarding the reference, which title to write in the case of female patients, like Miss or Mrs. In the case of male patients, there are very less chances of getting the doubt. Usually it's addressed as Mr. or Master, so there are very less chances of getting doubts. But in the case of female patients, there are so many doubts, like which to be placed, Miss or Mrs. So in the case of divorced, divorcee, widow, or single patient, and the patients below the age of 18, you can write it down as Miss. In case if the name of the patient is given without any title in the case notes, like Miss or Mrs. is not given, and it's given divorced, also you can write it as Miss. But if the title is already given as Mrs. or Miss, you should write down the same in the letter. For example, if it is given Mrs. Elizabeth John, widow, you can write the same title as Mrs. Elizabeth John. I think it is clear for you. If still you have any other doubts, you may please write it down in the comment section. Now, let's move on to the introduction of the letter. In the introduction, it's very important to write the purpose of the letter. It depends on the person or the profession of the reader. For example, if the letter is to a caregiver or the nurse, it can be regarding the care or continuing care. And if it is to a doctor, the purpose may be to do the assessment, the management, or for the follow-up review, and so on. Another important matter to be included in the introduction is the present condition of the patient or the diagnosis of the patient, for which we are referring the patient to the reader. Here, you also should note the type of the letter, whether it's a transfer from one facility to another or it is a discharge to home. So some letters may be for the transfer of care. In that case, you can write it as a referral letter or a transfer of care itself. Next is regarding the body paragraphs. Here we should make sure that we are not confusing the reader. Give maximum clarity and include more of the time indications instead of mentioning all dates. Instead of the dates, you may write it as after 1 day, 1 week, or 5 days, he underwent so and so procedures or tests. So it makes more and it becomes more understandable for the reader. Now, I would like to explain regarding choosing the relevant points. Okay, so here make sure to choose the points based on the reader and his discretion. Write only the things which come under the reader's discretion. Okay, there may be some points which are semi-relevant, which can be included or excluded from the letter based on the word count. For example, there may be many recommendations for the patient in the discharge plan. So you need not write everything. There may be many recommendations for the patient in the discharge plan. You need not write everything. Include only the things which the reader needs to do or can do. These recommendations should be written in the conclusion or the recommendation paragraph. So I hope everything is clear for you. Our next session, in the next session, I hope everything is clear. I hope everything is clear for you. In the next session, I will explain how to write the letters to the social worker or the dietitian. Thank you for watching. Bye-bye.